The chemical weapons hit Brussels at 03:47 hours. Nerve agents spread through the NATO headquarters like invisible death, turning the world's most secure military compound into a tomb. Within minutes, seasoned generals were convulsing on marble floors while emergency protocols crumbled into chaos. The best military doctors on Earth stood helpless, watching as standard antidotes failed against a toxin they'd never encountered. Then a soccer mom from Phoenix stepped through the quarantine zone carrying nothing but a pink canvas bag filled with what looked like vitamin bottles. Her business card still read Independent Wellness Consultant in cheerful script, but the moment she opened those containers, everything changed. Before we jump back in, tell us where you're tuning in from, and if this story touches you, make sure you're subscribed, because tomorrow, I've saved something extra special for you. The morning had started like any other Tuesday at NATO's Brussels headquarters. Coffee machines hummed in break rooms while intelligence analysts shuffled through overnight reports. General Patricia Hawthorne, a 40-year veteran with silver hair pulled back in regulation style, was reviewing deployment schedules when the first alarm sounded. Not the usual fire drill tone, but the deep, bone-rattling klaxon that meant only one thing: chemical attack. Emergency lights bathed the corridors in hellish red as blast doors slammed shut with metallic finality. The ventilation system went into lockdown mode, sealing the building's 23 floors into isolated compartments. But it was already too late. The invisible killer had found its way through systems designed to withstand conventional warfare, slipping past filters and sensors like water through sand. Dr. James Crawford, NATO's chief medical officer, was in the third-floor medical bay when the first casualties arrived. 2 security guards stumbled through the doors, eyes streaming tears, muscles twitching uncontrollably. Crawford's team moved with practiced efficiency, administering atropine and pralidoxime, the standard nerve agent cocktail that had saved countless lives in Syria and Iraq. The medications did nothing. The guards collapsed anyway, their nervous systems shutting down despite every protocol being followed to perfection. Crawford watched in growing horror as more victims poured in. Translators, analysts, even a 2-star general who'd survived 3 tours in Afghanistan, all succumbing to something that laughed at their medical arsenal. Outside the sealed building, emergency response teams in hazmat suits struggled to identify the agent. Mass spectrometers returned readings that made no sense. Chemical signatures that shouldn't exist. Molecular structures that defied classification. The toxin was synthetic, engineered, designed specifically to defeat every known countermeasure in NATO's medical database. Dr. Sarah Chen, the organization's top biochemist, worked frantically in her sealed laboratory, running sample after sample through equipment worth more than most people's homes. Each test result deepened the mystery. The compound bound to neural receptors in patterns she'd never seen, creating cascading failures that standard antidotes couldn't interrupt. It was as if someone had studied every NATO medical protocol and designed the perfect poison to defeat them all. General Hawthorne, now wearing a gas mask that made her voice sound mechanical, coordinated the crisis response from the Emergency Command Center. Screens showed the building's status in real time, contamination spreading through ventilation systems, casualties mounting by the hour, and outside agencies scrambling to provide support that might never arrive in time. The death toll climbed past 20, then 30. Medical staff, already stretched thin, began showing symptoms themselves despite their protective gear. Dr. Crawford felt his hands begin to shake as he administered ineffective treatments to colleagues who'd become patients. The most advanced military medical facility in Europe was becoming a mausoleum. That's when she walked through the quarantine perimeter. Margaret Maggie Sullivan looked exactly like what she was. A 42-year-old mother of 3 from a Phoenix suburb who sold wellness products to neighbors and friends through social media. Her blonde hair was pulled back in a practical ponytail, and she wore the kind of comfortable walking shoes favored by women who spent their days chasing after kids and attending PTA meetings. The pink canvas bag slung over her shoulder bore the logo of Vitalife Solutions, complete with a cheerful sunshine emblem that seemed absurdly out of place against the backdrop of military crisis. The hazmat team that escorted her through the outer perimeter exchanged skeptical glances. They'd been told to expect a specialist, someone with credentials that justified breaching quarantine protocols during the worst chemical attack in NATO's history. Instead, they got a woman whose business cards were printed on sparkly cardstock, and whose LinkedIn profile featured testimonials about increased energy levels and better sleep. Security Chief Rodriguez, a former Marine who'd seen action in 3 combat zones, met them at the entrance to the medical facility. His voice was muffled by his respirator mask, but the incredulity came through clearly. "This is our specialist?" "Ma'am, with all due respect, this isn't the time for alternative medicine." Maggie adjusted the strap of her bag and met his gaze steadily. Her voice was calm, carrying the kind of quiet confidence that came from years of explaining complex nutritional concepts to skeptical customers. "I understand your concern, Chief Rodriguez, but I'm not here to sell supplements. I'm here because my products might be the only thing standing between your people and complete nervous system failure." Dr. Crawford, exhausted and desperate, pushed through the crowd of medical personnel. His scrubs were stained with sweat and worse things, and his eyes held the hollow look of someone who'd watched too many people die despite his best efforts. "Are you seriously telling me that vitamin pills are going to cure nerve agent poisoning?" Maggie opened her bag and withdrew a small glass vial filled with what looked like ordinary capsules. The label read NeuroShield Advanced Formula in the same cheerful font used by thousands of MLM companies across America. But as she held it up to the harsh fluorescent lights, something in her manner made the room fall silent. "These aren't vitamins," she said quietly. "They're synthetic analogs of naturally occurring compounds that I've been developing for the past 8 years." The wellness angle was cover. Regulatory protection. When you're working on neurochemical binding agents that could revolutionize military medicine, it's safer to market them as dietary supplements. The silence stretched longer. General Hawthorne, monitoring the conversation through security feeds, felt her tactical instincts warring with disbelief. Outside agencies had confirmed this woman possessed the highest possible security clearances that shouldn't exist for someone selling health products on Instagram. But with the death toll approaching 50 and no other options on the table, conventional wisdom was a luxury they couldn't afford. Dr. Chen appeared in the doorway, her face pale behind her protective visor. "General, we just lost Dr. Martinez. The toxin is accelerating. At current progression rates, we're looking at total facility compromise within 6 hours." Maggie stepped forward, her pink bag suddenly seeming less absurd and more like a lifeline. "The compound you're dealing with is a modified organophosphate designed to overwhelm acetylcholinesterase production while simultaneously blocking receptor sites that standard antidotes target. It's brilliant, actually. Whoever created this understood neurotransmitter chemistry at a level that most pharmaceutical companies can't match." Dr. Crawford blinked hard, processing the technical language flowing from someone who, according to her public profile, had earned a degree in marketing from Arizona State. "How could you possibly know that?" Instead of answering directly, Maggie knelt beside the nearest victim, a young intelligence analyst whose breathing had become labored and irregular. She withdrew a capsule from her vial and broke it open, revealing a fine powder that glittered strangely under the lights. The human nervous system produces natural protective compounds when exposed to certain stressors. Most pharmaceutical approaches try to flood the system with synthetic blockers. I took the opposite approach. Enhance the body's existing defenses while providing targeted support for compromised neural pathways. She dissolved the powder in a small amount of saline solution and drew it into a syringe with movements that belonged to someone who'd done this many times before. The MLM business was perfect cover. I could test formulations on willing volunteers, gather data on dosage and effectiveness, all while maintaining the appearance of selling glorified vitamins to suburban housewives. General Hawthorne's voice crackled through the intercom system. "Ma'am, I need to know exactly who you are and who you work for before I authorize experimental treatment on my personnel." Maggie paused with the syringe in her hand, looking up at the security camera with eyes that held depths the others were only beginning to recognize. "I work for the same people you do, General. I always have. The difference is that my laboratory happened to be my kitchen counter, and my test subjects thought they were buying wellness products from their neighbor." She turned back to the patient and administered the injection with the practiced efficiency of a trauma medic. Some of the most effective pharmaceutical discoveries in history started as folk remedies that someone decided to study seriously. I just worked backwards from the chemistry, using regulatory loopholes to fund research that would have taken the Pentagon decades to approve through official channels. The effect was almost immediate. The analyst's breathing steadied. muscle spasms subsided, and his eyes regained focus for the first time since the attack began. The medical staff watched in stunned silence as vitals that had been plummeting began to stabilize. Dr. Crawford checked and rechecked the monitors, unwilling to believe what the data showed. His acetylcholine levels are normalizing. Neuroconductivity is improving. How is this possible? Maggie was already preparing the next dose, her movements quick and sure. The compound I developed doesn't just block the toxin. It actually repairs the damage at the synaptic level, while providing temporary scaffolding for compromised neural networks. Think of it as emergency surgery for your neurotransmitter system. She moved to the next patient, then the next, working with a rhythm that spoke of years of hidden expertise. Each injection brought improvement, sometimes dramatic, always measurable. The pink canvas bag that had seemed so ridiculous began to look like the most important piece of equipment in the building. Dr. Chen, watching the impossible recovery unfold, finally asked the question everyone was thinking. Who trained you to do this? This isn't something you learn from YouTube videos about supplements. Maggie glanced up briefly while preparing another dose. Johns Hopkins, PhD in neurochemistry, postdoc in pharmacology at Stanford. Recruited by a program that doesn't officially exist to develop countermeasures for threats that aren't supposed to be possible. She returned to her work, voice matter of fact. The soccer mom thing was my idea. Best deep cover I could think of. No one suspects the woman selling protein shakes at the school pickup line of being a biochemical weapons specialist. The treatment continued through the night. Maggie worked without pause, moving from patient to patient with supplies that seemed impossibly well suited to this specific crisis. Her pink bag, which had looked so out of place in the sterile military environment, proved to contain not just antidotes but a complete emergency medical kit disguised as wellness products. Recovery rates defied every medical.
Preparing and narrating this story took us a lot of time, so if you are enjoying it, subscribe to our channel. It means a lot to us. Now back to the story.
Model, Dr. Crawford knew. Patients who should have died were sitting up within hours. Their nervous systems not just stabilized but actively repairing damage that standard protocols would have considered permanent. The mysterious toxin that had seemed unstoppable was being systematically defeated by formulations that bore cheerful names like Energy Boost Plus and Mental Clarity Support. As dawn broke over Brussels, the crisis that had threatened to cripple NATO's leadership structure was becoming a case study in unconventional solutions. General Hawthorne, finally able to remove her gas mask as air quality returned to safe levels, found Maggie in the cafeteria, sitting alone with a cup of coffee that had gone cold hours ago. 53 lives, the general said, settling into the chair across from her. That's how many people you saved last night. People with families, with missions that matter to global security. I need to understand how someone with your capabilities ended up selling supplements in Phoenix. Maggie smiled for the first time since arriving, and it transformed her entire appearance. The exhausted medical specialist faded away, replaced by the warm, approachable woman who had built a successful wellness business through genuine care for her customers. The supplements work, you know. Not for nerve agents, obviously, but for their intended purposes. I've helped thousands of people feel better, sleep better, think more clearly. There's value in that kind of work, even if it's not saving the world. She gestured toward the medical bay where her patients continued their remarkable recovery. But this is why I really do it. The research, the development, the endless testing. Because someday, someone is going to create a weapon designed to kill people in ways we haven't seen before. And when that happens, someone needs to be ready with solutions that don't exist yet. General Hawthorne studied her carefully, seeing past the suburban disguise to the brilliant scientist beneath. How many others are there, people like you, hiding in plain sight? More than you'd think, fewer than we need. Maggie finished her cold coffee and grimaced. Military researchers are brilliant, but they're also constrained by oversight, budget cycles, ethical review boards. Sometimes the best way to advance critical research is to make it look like something completely harmless. The cleanup took 3 more days. Decontamination teams in full protective gear swept every surface while forensic specialists worked to identify the source of the attack. The toxin, they eventually determined, had been introduced through the building's coffee service, a revelation that sent shockwaves through security protocols across every major government facility in Europe. Maggie's role in the response was classified at levels that made her officially invisible. The after-action reports mentioned, quote, specialized pharmaceutical intervention and novel treatment protocols, but contained no reference to the woman who had walked into a quarantine zone with nothing but a pink bag and impossible expertise. She flew back to Phoenix on a commercial airliner, sitting in coach between a businessman reading financial reports and a college student sleeping against the window. Her boarding pass listed her occupation as sales representative, and nothing in her appearance suggested she'd spent the previous week saving NATO's command structure from biological warfare. The VitalLife Solutions website remained active, featuring the same testimonials about increased energy and better sleep. Maggie's social media accounts continued to showcase before and after photos from satisfied customers, special promotions on popular products, and inspirational quotes about wellness and self-care. To anyone looking, she was exactly what she appeared to be, a successful MLM distributor who'd built her business through hard work and genuine belief in her products. But in certain classified databases, accessible only to individuals with clearances that took years to obtain, Margaret Sullivan's name carried annotations that told a different story. Recognition for services that couldn't be publicly acknowledged, commendations for achievements that would never appear in newspapers, and most importantly, a phone number that would connect directly to her cell phone, day or night, in case the world needed her particular expertise again. Dr. Crawford, back in his laboratory at NATO headquarters, kept one of her capsules in a secure storage unit. He'd run every test imaginable on the remaining samples, but the formulation remained partially opaque, protected by molecular complexity that would take his team years to fully reverse engineer. Sometimes, late at night, when he was alone in the lab, he'd look at that innocuous capsule and marvel at the intersection of genius and necessity that had created it. The victims of the attack recovered completely, their nervous systems showing no long-term effects from exposure to a toxin that should have killed them all. They returned to their duties with clean medical records and no memory gaps, the standard protocol for incidents involving classified countermeasures. Most never learned the details of what had saved their lives. General Hawthorne kept Maggie's business card in her wallet, though she never told anyone why. The sparkly cardstock with its cheerful sunshine logo served as a reminder that the most dangerous threats often came from unexpected directions, and that the most effective responses might come from equally unexpected sources. In Phoenix, Maggie Sullivan continued building her wellness business. She hosted product parties in her living room, offered nutrition consultations at the local coffee shop, and maintained the kind of enthusiastic social media presence that made her neighbors think she'd found the perfect work-life balance. Her 3 children knew their mother worked from home selling health products, and they were proud of her success in helping people feel better. What they didn't know, what none of her customers or colleagues suspected, was that their living room had occasionally served as a clandestine laboratory where groundbreaking pharmaceutical research was conducted under the cover of developing natural wellness supplements. The kitchen counter where she packaged orders for shipping had also been the testing ground for compounds that could neutralize chemical weapons developed by hostile nations. The MLM industry, with its emphasis on personal testimonials and word-of-mouth marketing, provided the perfect environment for conducting human trials that would have been impossible through traditional pharmaceutical channels. Every customer who reported improved mental clarity or reduced anxiety was unknowingly contributing data to research that could save thousands of lives in scenarios they'd never imagine. Maggie's upline in the VitalLife Solutions compensation structure had no idea they were receiving commissions from someone whose real research budget came from Black Project funding. Her downline distributors, eager to learn her marketing secrets, attended training sessions where she taught them to identify customer needs and match them with appropriate products, skills that served double duty in her other profession. The regulatory environment that allowed dietary supplements to be sold without FDA approval for specific medical claims created a space where serious pharmaceutical research could be conducted away from the scrutiny that typically surrounded weapons-related development. By positioning her work as wellness enhancement rather than medical treatment, Maggie had found a way to advance critical national security research while helping ordinary people improve their daily lives. Her success in the MLM world was genuine, built on products that actually worked for their intended purposes and sustained by the kind of personal attention that turned customers into lifelong advocates. The financial independence this provided allowed her to fund increasingly sophisticated research without raising questions about the source of her laboratory equipment or the complexity of her formulations. The attack on NATO headquarters had been her first major deployment, but it wasn't her first time using unconventional channels to address emerging threats. Over the years, her vitamin formulations had quietly neutralized 3 biological agents, provided protection against 2 different neurotoxins, and offered treatment for exposure to experimental chemicals that existed only in the research facilities of hostile nations. Each success reinforced the value of her unconventional approach. While traditional pharmaceutical companies spent years navigating regulatory approval processes, Maggie could develop, test, and deploy countermeasures in months, using a distribution network that looked like neighborhood commerce, but functioned as a sophisticated early warning system for chemical and biological threats. Her customers, unknowingly, had become part of that system. The wellness consultant who helped them choose the right supplements for better sleep was also monitoring population health patterns that might indicate the testing of new biological agents. The friend who recommended products for stress management was simultaneously tracking psychological effects that could signal exposure to experimental psychological warfare compounds. The genius of the system lay in its mundane appearance. Intelligence agencies around the world had learned to monitor pharmaceutical companies, university research departments, and military contractors for signs of weapons development or countermeasure research. But no one was watching the suburban mother who sold vitamins at soccer games and school fundraisers. Maggie's 3 children, now in their teens, had grown up understanding that their mother's work was important in ways they weren't old enough to fully comprehend. They knew she sometimes received urgent phone calls that sent her traveling on short notice, usually with explanations about, quote, consulting opportunities or product development conferences. What they saw was a mother who had found a way to contribute meaningfully to her family's financial security, while maintaining the flexibility to attend their school events and support their activities. What they didn't see was the sophisticated laboratory equipment hidden behind false walls in the basement, or the encrypted communication systems that allowed their living room to function as a command center for responding to chemical weapons attacks on the other side of the world. The balance between her public role and her classified work required constant vigilance. Social media posts had to be carefully curated to maintain her cover while avoiding any content that might accidentally reveal her true capabilities. Business trips needed believable explanations that wouldn't raise questions from neighbors or customers. Most challenging of all, she had to maintain the enthusiastic, optimistic persona that made her successful in direct sales, while carrying the weight of knowledge about threats most people couldn't imagine. But the system worked. In 8 years of operation, no one had questioned why a suburban wellness consultant possessed expertise in advanced neurochemistry, or why her product formulations showed unusual sophistication compared to typical MLM offerings. The VitaLife Solutions brand had provided perfect cover for research and development that traditional channels could never have supported. The success in Brussels proved the concept beyond any doubt. When faced with an unprecedented chemical weapons attack, NATO's best medical minds had been helpless. Standard protocols had failed completely. But the soccer mom from Phoenix, armed with nothing but products that looked like vitamin supplements, had saved 53 lives and prevented what could have been the most devastating attack on Western military leadership in decades. As Maggie returned to her routine of customer consultations and product deliveries, she carried with her the satisfaction of knowing that her unconventional approach to national security had proven itself under the most extreme circumstances. The pink canvas bag that had seemed so out of place in a military crisis had contained solutions that existed nowhere else on Earth. The MLM industry would continue to face skepticism from those who saw only pyramid schemes and questionable marketing claims. But hidden within its structure, protected by regulatory loopholes and sustained by genuine customer satisfaction, was a research and development network that provided capabilities no traditional organization could match. And in Phoenix, Margaret Sullivan would continue building her wellness business, one customer at a time, one product at a time, secure in the knowledge that she was serving both her community and her country in ways that neither could fully understand. The next time someone dismissed MLM distributors as naive or misguided, they might want to consider the possibility that the enthusiastic woman selling vitamins at the neighborhood party might be carrying expertise that could save their life. Because sometimes, the most important work happens in the most ordinary places. protected by assumptions that no one thinks to question. In a world where threats evolved faster than traditional responses could be developed, unconventional solutions weren't just valuable, they were essential. And sometimes, those solutions came packaged in sparkly business cards and carried in pink canvas bags by soccer moms who understood that the best way to hide revolutionary pharmaceutical research was to make it look exactly like something no one would ever take seriously. 3 months after Brussels, the world had moved on. News cycles churned through other crises while classified reports buried the truth beneath layers of bureaucratic language. But in the shadowy networks where real intelligence flowed, whispers carried a different story. A suburban wellness consultant had accomplished what billion-dollar pharmaceutical companies couldn't, using nothing more than products marketed through social media posts and neighborhood coffee meetings. Dr. Elena Vasquez, head of biochemical defense at the Centers for Disease Control, sat in her Atlanta office, staring at samples that defied explanation. The compounds Maggie Sullivan had used in Brussels represented a quantum leap in neurochemical intervention, but reverse engineering them had proven impossible. Every analysis revealed new layers of molecular complexity, synthetic pathways that shouldn't exist outside of the most advanced research facilities on Earth. The official request had come through proper channels, couched in the diplomatic language of interagency cooperation. NATO wanted to understand the countermeasures that had saved their headquarters, and the CDC's Advanced Biochemistry Division was tasked with providing answers. What Dr. Vasquez had discovered instead was a pharmaceutical puzzle that challenged everything she thought she knew about drug development. The capsules looked innocuous enough, standard gelatin shells containing what appeared to be vitamin powder. But spectroscopic analysis revealed a molecular structure more complex than most cancer drugs, with binding properties that targeted neural pathways no one had thought to map. The compound wasn't just treating nerve agent poisoning, it was actually repairing damage at the cellular level while providing protection against future exposure. Dr. Vasquez had spent 15 years studying chemical weapons countermeasures, working with teams from Johns Hopkins, MIT, and the Army's Chemical Research Facility at Edgewood. She'd reviewed classified Soviet research from the Cold War, analyzed samples from Syrian chemical attacks, and consulted on responses to terrorist incidents involving industrial toxins. Nothing in her experience suggested that this level of pharmaceutical sophistication could emerge from the MLM wellness industry. Her assistant, Dr. Marcus Chen, knocked on her office door carrying another batch of test results. His expression mixed frustration with grudging admiration, the look of a scientist confronting data that didn't fit established models. "The neuroplasticity enhancement is off the charts," he said, spreading printouts across her desk. "This compound doesn't just neutralize acetylcholinesterase inhibitors. It actively promotes synaptic regeneration at rates we've never seen." Dr. Vasquez studied the graphs, each line representing a breakthrough that pharmaceutical giants would kill to achieve. "Run the analysis again. Check for contamination, measurement errors, anything that could explain these numbers. I've run it 6 times with 3 different machines. The results are consistent." Dr. Chen pulled up a chair, his voice dropping to the conspiratorial tone researchers used when discussing results too extraordinary for public consumption. "Elena, this isn't just medicine. This is enhancement. The compound doesn't just restore normal neural function. It improves it beyond baseline levels." The implications hung in the air between them. Chemical weapons countermeasures were designed to prevent death, not to enhance human performance. The line between defensive medicine and human augmentation was carefully monitored by ethics boards, international treaties, and regulatory agencies that took a dim view of experiments that pushed the boundaries of what the human body could achieve. Dr. Vasquez's phone buzzed with an encrypted message from her contact at Fort Detrick. The Army's Biological Defense Research Facility had been conducting parallel analysis of the Brussels samples, and their findings matched the CDC's results exactly. More troubling, they discovered that similar compounds had been used in at least 4 other incidents over the past 2 years, all involving chemical exposure situations that had resolved with unusually positive outcomes. The pattern was subtle but unmistakable. Industrial accidents where workers should have suffered permanent neurological damage but recovered completely. Food poisoning outbreaks that should have killed dozens but resulted in no fatalities. Environmental contamination incidents where exposed populations not only survived but reported improved cognitive function and physical stamina in the months following treatment. Each incident had been treated as a fortunate anomaly, credited to quick medical response or overestimated toxicity levels. But when viewed together, they painted a picture of systematic intervention using pharmaceutical technology that officially didn't exist. Someone had been quietly deploying advanced countermeasures disguised as routine medical treatment, saving lives while conducting what amounted to human trials on an unprecedented scale. Dr. Vasquez pulled up Margaret Sullivan's public profile, scrolling through social media posts that showcased a successful MLM distributor living the American dream. Photos of family vacations, motivational quotes about entrepreneurship, and endless testimonials from satisfied customers who credited her products with transforming their health and energy levels. Nothing in the digital footprint suggested the kind of advanced scientific training required to develop the compounds that had saved NATO's leadership. But buried in the wellness industry's cheerful marketing language were clues that a trained biochemist could recognize. Customer testimonials describing improvements in mental clarity and stress resilience that aligned perfectly with the neurochemical effects Dr. Vasquez had observed in laboratory testing. Product descriptions that used terminology just sophisticated enough to suggest deeper knowledge while remaining accessible to suburban customers seeking natural health solutions. The Vita Life Solutions product line included formulations for cognitive enhancement, stress management, immune system support, and energy optimization. Each category corresponded to pharmaceutical applications that major drug companies spent billions trying to achieve through traditional research and development. Yet here was a Phoenix soccer mom apparently accomplishing breakthrough results using ingredients that could be purchased legally as dietary supplements. Dr. Chen pulled up manufacturing records for Vita Life Solutions, using CDC authority to access information that would normally be protected by privacy regulations. The company's supply chain revealed a network of specialized chemical suppliers that seemed unusually sophisticated for a typical MLM operation. Raw materials were sourced from pharmaceutical-grade facilities in Switzerland, Japan, and Germany, with quality control standards that exceeded most prescription drug manufacturers. The production facility registered in Arizona was listed as a small batch supplement manufacturer, but the equipment inventory included molecular synthesis apparatus worth millions of dollars. Insurance records showed coverage for chemical research activities, and utility usage patterns suggested energy-intensive manufacturing processes that went far beyond mixing vitamin powders into capsules. "This isn't a supplement company," Dr. Chen said quietly, comparing the equipment list to what he'd seen at major pharmaceutical research facilities. "This is a full-scale drug development operation masquerading as a wellness business. The MLM structure is just distribution and marketing." Dr. Vasquez felt the pieces clicking into place with the satisfaction of a puzzle finally revealing its picture. The MLM model provided perfect cover for human trials, allowing systematic testing of experimental compounds on willing volunteers who believed they were purchasing natural health products. The testimonials and customer feedback created a database of effectiveness and side effects that would take traditional pharmaceutical companies years to compile through formal clinical trials. More importantly, the regulatory environment that governed dietary supplements allowed for innovation and deployment without the oversight that constrained legitimate pharmaceutical research. By positioning her work as wellness enhancement rather than medical treatment, Margaret Sullivan had created a space where she could develop and test advanced pharmaceutical compounds with a freedom that traditional researchers could only dream of. The business model was brilliant in its simplicity. Customers paid for products that genuinely improved their health and energy levels, creating the kind of authentic testimonials that drove MLM success. Meanwhile, each purchase provided funding for continued research and development, while customer feedback generated data on dosage, effectiveness, and optimal formulations. Dr. Vasquez's secure phone rang with the distinctive tone reserved for calls from Washington. The voice on the other end belonged to Director Sarah Morrison from the Defense Advanced Research Projects Agency, DARPA's liaison for biological and chemical defense initiatives. Her tone carried the urgency that came with classified information requiring immediate attention. "Dr. Vasquez, we need to talk about your Brussels analysis. How quickly can you get to Washington?" "Director Morrison, I was just reviewing the test results. The pharmaceutical sophistication is unlike anything we've seen from conventional sources. That's exactly why we need to meet in person. There are aspects of this situation that can't be discussed over any electronic communication, no matter how secure. Can you be here tomorrow morning?" Dr. Vasquez glanced at her calendar, mentally rearranging appointments and delegating urgent projects to her staff. I'll catch the first flight out. Should I bring Dr. Chen? Bring your entire analysis team and every sample you have. This briefing is going to change your understanding of pharmaceutical research in ways you're not prepared for. The line went dead, leaving Dr. Vasquez staring at her phone with the unsettled feeling that came with glimpsing the edges of information too sensitive for normal channels. DARPA's involvement suggested that Margaret Sullivan's work had implications far beyond the Brussels incident, touching on research priorities that connected to national security in ways she was only beginning to understand. The flight to Washington gave Dr. Vasquez time to review everything her team had discovered about the compounds that had saved NATO's headquarters. Each analysis had raised new questions while providing answers that seemed to violate the established rules of pharmaceutical science. The molecular structures were too complex to have emerged from conventional research, yet too precise to represent accidental discoveries. Dr. Chen, seated beside her on the aircraft, worked through calculations that attempted to reverse engineer the synthesis pathways required to create such sophisticated compounds. His equations filled page after page of his notebook, each one representing months or years of research that should have been required to achieve the results they'd observed in testing. The cognitive enhancement effects are the most troubling aspect, he said quietly, ensuring their conversation wouldn't carry to other passengers. We're not just looking at medical countermeasures. These compounds actively improve neural processing speed, memory formation, and pattern recognition. That crosses the line from treatment into human augmentation. Dr. Vasquez nodded, understanding the implications that Dr. Chen was reluctant to voice directly. Human enhancement research was one of the most heavily regulated areas of pharmaceutical science, governed by international treaties and ethical oversight that made progress glacially slow. The idea that such breakthroughs could emerge from the unregulated world of dietary supplements represented either an incredible oversight in regulatory policy or evidence of research programs that operated outside normal institutional boundaries. The DARPA briefing took place in a secure facility beneath the Pentagon, in conference rooms designed to contain conversations that could reshape global strategic thinking. Director Morrison met them at the security checkpoint, her expression carrying the weight of information that had kept her awake for weeks since the Brussels incident first crossed her desk. The conference room was occupied by representatives from every major defense and intelligence agency, creating the kind of interagency gathering that signaled classified information of the highest importance. Dr. Vasquez recognized faces from previous briefings on chemical weapons threats, biological defense initiatives, and pharmaceutical research programs that existed in the classified world parallel to public medical science. Director Morrison activated the room's electronic countermeasures and gestured for everyone to be seated. The screens around the conference table displayed molecular structures that Dr. Vasquez immediately recognized as the compounds from Margaret Sullivan's formulations, but with additional detail that her CDC analysis had failed to capture. Ladies and gentlemen, what you're about to learn is classified at levels that will require additional security clearances for some of you. The Brussels incident was not an isolated event, and the countermeasures employed were not the result of fortunate accidents or inspired improvisation. The first slide showed a timeline stretching back 8 years, with dozens of incidents marked at regular intervals across multiple continents. Chemical spills, biological exposures, industrial accidents, and terrorist attacks, all connected by the presence of advanced pharmaceutical countermeasures that had prevented casualties and minimized long-term health effects. Margaret Sullivan's work represents the most successful deep-cover research program in the history of pharmaceutical science. Operating under commercial cover that provided both funding and human trial opportunities, she has developed countermeasures for chemical and biological threats that we didn't even know existed. Dr. Vasquez studied the timeline, recognizing several incidents that had been reported as medical miracles or examples of exceptional emergency response. The Fukushima reactor workers who showed no signs of radiation poisoning despite prolonged exposure. The Syrian refugee camp that avoided cholera outbreak despite contaminated water supplies. The London subway incident where suspected chemical weapons exposure resulted in complete recovery for all victims. Each intervention was carefully orchestrated to appear routine, Director Morrison continued. Local medical personnel received supplies and instructions through channels that seemed to originate from international aid organizations or pharmaceutical companies providing emergency assistance. The treatments were administered as standard medical care, with no indication that experimental compounds were being deployed. Dr. Chen raised his hand, his voice carrying the skepticism of a scientist confronting claims that challenged established understanding. Director Morrison, the level of pharmaceutical sophistication we observed requires research infrastructure worth hundreds of millions of dollars. How could a single individual operating under commercial cover achieve results that pharmaceutical giants can't match? The next slide revealed the answer in organizational charts that connected VitaLife Solutions to a network of research facilities, chemical suppliers, and testing laboratories that spanned 3 continents. The MLM company was the public face of a research consortium that included Nobel Prize winners, former pharmaceutical executives, and scientists who had officially retired from their previous positions but continued working under private contracts. The genius of the program lies in its distributed nature, Director Morrison explained. No single facility contains the complete picture. Research is compartmentalized across dozens of laboratories, each working on specific aspects of compound development, while believing they're contributing to conventional pharmaceutical research. The supply chain that Dr. Chen had identified was revealed to be far more sophisticated than their initial analysis had suggested. Raw materials were synthesized at facilities that specialized in pharmaceutical precursors, processed through intermediate stages at chemical companies that believed they were supporting legitimate drug development, and assembled into final products at manufacturing sites that maintained the highest security and quality standards. Margaret Sullivan's role is coordination and field deployment. She possesses the scientific training to understand the research being conducted across the network, the business acumen to maintain commercial cover, and the operational skills to deploy countermeasures in crisis situations without revealing the program's existence. Dr. Vasquez felt her understanding of pharmaceutical research shifting in fundamental ways. The model they were describing represented a revolution in how advanced medical research could be conducted, using commercial structures and regulatory environments to achieve breakthroughs that traditional academic or corporate research couldn't match. The MLM structure provides perfect human trial opportunities, she said, beginning to appreciate the elegance of the system. Customers provide informed consent for product use while generating data on effectiveness and side effects. The business model ensures sustainable funding while creating genuine customer satisfaction that supports the commercial cover story. Director Morrison nodded, advancing to slides that showed customer demographics, testimonial analysis, and health outcome tracking across the VitaLife Solutions customer base. The data revealed systematic improvement in cognitive function, immune response, and stress resilience among regular product users, effects that extended far beyond what conventional supplements could achieve. The customer base has become an early warning system for emerging biological and chemical threats, she continued. Health monitoring built into the product ordering system can detect population-level exposure to novel toxins, providing intelligence on weapons development and testing by hostile nations. The briefing continued for 3 hours, revealing layers of sophistication that transformed Dr. Vasquez's understanding of what modern pharmaceutical research could accomplish when freed from traditional institutional constraints. The program represented not just scientific breakthrough, but operational innovation that could reshape how the United States responded to emerging chemical and biological threats. As the meeting concluded, Director Morrison handed each attendee a classified folder containing assignment details for their agencies, roles in expanding the program. The success in Brussels had proven the concept beyond any doubt, but the scale of emerging threats required capabilities that went far beyond what a single researcher, no matter how brilliant, could provide. Dr. Vasquez's CDC will be responsible for establishing additional research nodes using the VitaLife model. We need similar operations in at least 6 major metropolitan areas within 18 months, each focused on specific threat categories and population monitoring requirements. Dr. Vasquez accepted the folder with hands that trembled slightly, understanding that her career had just shifted into territory that didn't appear on any organizational chart. The work would continue under her existing CDC position, but the real mission would involve capabilities that officially didn't exist, funded through budgets that were invisible to congressional oversight. The flight back to Atlanta gave her time to absorb the magnitude of what she'd learned. Margaret Sullivan wasn't just a brilliant scientist who had found an innovative way to fund and conduct pharmaceutical research. She was the architect of a new model for biological defense that could respond to threats faster than traditional government programs could even identify them. The MLM industry, Dismissed by most serious researchers as a haven for questionable health claims and predatory business practices, had provided cover for the most sophisticated pharmaceutical research program in American history. The suburban mothers and entrepreneurial professionals who formed VitalLife Solutions' customer base were unknowingly participating in the most comprehensive human health monitoring system ever deployed. Dr. Vasquez's phone buzzed with a text message from Margaret Sullivan herself, sent from an untraceable number that would disappear within minutes of delivery. The message contained nothing but coordinates and a time, the kind of communication that indicated a face-to-face meeting in a location chosen for security rather than convenience. The meeting took place at a small coffee shop in a Phoenix suburb, the kind of place where suburban professionals gathered for informal business discussions and mothers coordinated carpools over lattes. Margaret Sullivan looked exactly as she had in her social media photos, dressed in casual business attire that suggested success without ostentation. She stood to greet Dr. Vasquez with the warm smile that had made her successful in direct sales, but her eyes held depths that spoke of knowledge and responsibility that few people could comprehend. They found a corner table away from the afternoon crowd, two women discussing what appeared to be nothing more consequential than wellness products and business opportunities. Dr. Vasquez, I understand you've been briefed on the broader program, Maggie said, her voice carrying the same calm confidence that had impressed NATO's medical staff during the Brussels crisis. I wanted to meet personally to discuss how we can scale the model without losing the elements that make it effective. Dr. Vasquez studied the woman across from her, still struggling to reconcile the suburban wellness consultant with the architect of revolutionary pharmaceutical research. The scientific sophistication of your compounds challenges everything I thought I knew about drug development. How did you achieve results that pharmaceutical companies with billion-dollar budgets can't match? Maggie's smile deepened with genuine warmth, the expression of someone who had found profound satisfaction in work that few people could understand. The pharmaceutical industry is constrained by regulatory requirements, shareholder expectations, and risk management policies that prioritize safety over innovation. Those constraints are necessary for public protection, but they also limit what's possible when facing novel threats. She gestured toward the coffee shop's customers, suburban professionals, and stay-at-home mothers, who represented the demographic foundation of MLM success. This environment provides something that traditional research can't: willing participants who are motivated by genuine desire for better health rather than financial compensation. Their feedback is honest, their compliance is excellent, and their loyalty creates the kind of long-term data collection that formal clinical trials can't match. Dr. Vasquez began to understand how Margaret had transformed the limitations of MLM marketing into advantages for pharmaceutical research. The personal relationships that drove direct sales success created trust that made customers willing to try new formulations and provide detailed feedback on their experiences. The social networks that made MLM businesses sustainable also provided distribution channels that could reach target populations faster than any traditional pharmaceutical marketing campaign. The key insight was realizing that wellness enhancement and threat mitigation are the same research problem approached from different angles, Maggie continued. Compounds that improve cognitive function under normal conditions also provide protection against neurotoxins. Formulations that enhance immune response help customers feel more energetic while creating resistance to biological weapons. The conversation continued for 2 hours, with Maggie explaining research methodologies that blended cutting-edge pharmaceutical science with business practices that had made MLM companies among the fastest-growing sectors of American commerce. She described quality control standards that exceeded FDA requirements, customer service protocols that generated intelligence on population health trends, and product development cycles that could respond to emerging threats in weeks rather than years. As the meeting concluded, Dr. Vasquez realized that her understanding of pharmaceutical research had been fundamentally transformed. The model that Margaret Sullivan had created represented not just scientific innovation, but a new paradigm for how advanced medical research could be conducted in an era where traditional institutional approaches were too slow to address rapidly evolving threats. The suburban coffee shop where they'd met continued its afternoon routine as they parted ways, customers discussing ordinary concerns, while two women who had just planned the expansion of America's most sophisticated biological defense program blended back into the crowd. The revolution in pharmaceutical research would continue to hide in plain sight, protected by assumptions that no one would think to question. Dr. Vasquez returned to her CDC laboratory with assignment details that would transform her agency's role in biological defense, while Margaret Sullivan drove home to prepare for her daughter's soccer practice, carrying secrets that could reshape global security while maintaining the cover that had made her program's success possible. The future of pharmaceutical research would be written not in corporate boardrooms or government laboratories, but in living rooms and coffee shops, where ordinary people gathered to discuss products that were quietly changing what it meant to be human in an age of emerging biological threats. 2 years later, the network had expanded beyond anyone's initial projections. What began as Margaret Sullivan's ingenious solution to pharmaceutical research constraints had evolved into a global intelligence operation disguised as the wellness industry's most successful entrepreneurial movement. From Phoenix to Prague, from Seoul to Stockholm, suburban entrepreneurs were unknowingly operating the most sophisticated biological monitoring system in human history. Dr. Amanda Rodriguez received the emergency alert while reviewing quarterly health metrics at her CDC station in Miami. The automated system that monitored VitaLife Solutions' customer health reports had detected an anomaly in the southeast region, a subtle pattern of neurological symptoms that suggested exposure to an unknown compound. The alert wasn't loud or dramatic, just a quiet notification that appeared on her secure workstation alongside routine epidemiological data. But Amanda had been trained to recognize the significance of quiet alerts. In the 2 years since the Brussels incident, she'd learned that the most dangerous threats announced themselves through whispers rather than screams, appearing as statistical variations that could easily be dismissed as coincidence by anyone who didn't know what to look for. The pattern was emerging across 3 states, affecting VitaLife customers who had reported unusual fatigue, mild cognitive impairment, and disrupted sleep patterns over the past 6 weeks. Individually, each report seemed insignificant, the kind of minor health complaint that people mentioned when ordering their monthly supplement supply. Collectively, they painted a picture of systematic exposure to something that shouldn't exist. Amanda initiated the emergency response protocol that had been developed following Margaret Sullivan's success in Brussels. Within minutes, encrypted messages flowed through networks that connected wellness consultants, research laboratories, and intelligence analysts across multiple agencies. The suburban mothers who sold health products at school fundraisers became data collection points for a threat assessment that could determine whether hostile nations were testing biological weapons on American civilians. In Phoenix, Margaret received the alert while hosting a product party in her living room, surrounded by neighbors who were sampling new formulations while discussing their health goals and family challenges. She excused herself to check the message, her expression maintaining the warm enthusiasm that made her successful in direct sales, while her mind processed intelligence that required immediate action. The neurological symptoms matched compounds that existed only in classified research files, experimental neurotoxins that combined industrial chemicals with biological agents to create effects that mimicked natural illness while causing permanent cognitive damage. The fact that VitaLife customers were experiencing these symptoms meant that someone was conducting unauthorized testing on American soil, using exposure methods sophisticated enough to target specific demographic groups. Margaret's response was swift and invisible to her party guests. While demonstrating the benefits of her latest cognitive enhancement formula, she sent coded messages to research facilities across 3 continents, initiating the synthesis of countermeasures that had been pre-positioned for exactly this scenario. The compounds required for treatment were already in development, waiting only for confirmation of the specific threat profile to begin mass production. Dr. Elena Vasquez, now coordinating the expanded network from her position at the CDC, convened an emergency conference call that connected research nodes across 12 major metropolitan areas. Each location reported similar patterns, confirming that the exposure wasn't limited to the southeast but represented a coordinated attack affecting multiple regions simultaneously. The sophistication of the threat impressed even experienced intelligence analysts. The compound being deployed was designed to cause symptoms that resembled common stress-related health issues, easily dismissed by conventional medical evaluation, while creating cumulative neurological damage that would manifest as early-onset dementia in 5 to 10 years. By the time the effects became obvious, millions of people would be affected, creating a public health crisis that could cripple American economic and military capabilities. But the attackers had made one critical miscalculation. They had assumed that the American medical surveillance system, operated like traditional government programs, with centralized reporting that could be overwhelmed or compromised. They hadn't accounted for a distributed network of wellness consultants who maintained personal relationships with their customers, creating an early warning system that detected population health changes faster than any conventional epidemiological monitoring. Margaret's countermeasures began deployment within 72 hours of the initial alert. Working through her established distribution network, she released what appeared to be a seasonal wellness promotion, offering enhanced formulations designed to support cognitive function and stress resilience during challenging times. The new products contained compounds specifically engineered to neutralize the effects of the unknown neurotoxin, while providing the same health benefits that customers expected from their regular supplement regimen. The response was invisible to everyone except the intelligence analysts who monitored the results. Within 2 weeks, reported symptoms began declining across all affected regions. Customers attributed their improved energy and mental clarity to the effectiveness of Margaret's new formulations, while medical professionals noted the disappearance of the unusual neurological complaints that had briefly appeared in their patient populations. The attack had been neutralized without public awareness that an attack had ever occurred. The hostile intelligence operation that had spent months positioning assets for a devastating biological assault found their weapons rendered ineffective by countermeasures that appeared to be nothing more than vitamin supplements sold through social media marketing campaigns. But Margaret knew that this victory represented escalation rather than resolution. The sophistication of the attack indicated that foreign adversaries had developed capabilities that exceeded previous threat assessments, and their willingness to target American civilians suggested desperation or confidence that worried intelligence analysts across multiple agencies. The expanded network received authorization for capabilities that pushed the boundaries of what could be achieved through commercial cover. Research facilities that had operated as pharmaceutical contractors began developing compounds that enhanced human performance beyond natural limits. Manufacturing sites increased production capacity while maintaining the appearance of small-batch supplement operations. Distribution networks expanded into international markets, creating global monitoring capabilities disguised as entrepreneurial success stories. Dr. James Morrison, Margaret's handler at DARPA, visited Phoenix to discuss the program's evolution from defensive countermeasures to strategic capabilities that could reshape global power dynamics. They met at the same suburban coffee shop where Margaret had first explained her vision to Dr. Vasquez, two professionals discussing what appeared to be business development while planning operations that would define America's biological defense strategy for the next generation. "The network has exceeded every performance metric we established," Morrison said, reviewing classified assessments that measured the program's impact across multiple threat categories. "You've created something that doesn't fit existing models for how advanced research gets conducted, and the results speak for themselves." Margaret sipped her coffee while studying reports that documented the network's capabilities, seeing her initial concept transformed into something larger and more complex than she had originally envisioned. The MLM structure that had provided perfect cover for individual research had evolved into a global intelligence platform that could detect and respond to biological threats anywhere in the world. "The success creates new vulnerabilities," she said quietly, her voice carrying the concern of someone who understood the weight of responsibility that came with capabilities no one else possessed. "The more effective we become, the more attention we attract from people who want to understand how we're achieving these results." Morrison nodded, acknowledging the challenge that came with operating advanced research programs under commercial cover. Intelligence agencies from multiple countries had begun investigating the unusual success of American wellness companies, seeking explanations for health improvements that seemed to exceed what dietary supplements could provide. "We're developing additional cover layers," he assured her. "Academic research partnerships, pharmaceutical licensing agreements, technology transfer programs that provide plausible explanations for the capabilities we've demonstrated. The goal is to make the network appear to be the result of conventional research breakthroughs rather than classified programs." The conversation continued as they walked through Margaret's neighborhood, two people discussing business opportunities while planning operations that could determine whether America maintained its technological advantage in an era of rapidly evolving biological threats. The suburban setting provided perfect camouflage for discussions that would reshape global security architecture. Margaret's children, now in college, had grown up understanding that their mother's work involved responsibilities beyond selling health products to neighbors and friends. They knew she traveled frequently for consulting projects, maintained unusual work hours, and possessed expertise that seemed inconsistent with her public role as an MLM distributor. But they also knew that asking detailed questions about her work wasn't encouraged, and they'd learned to be proud of her success without fully understanding its significance. The program's success had created opportunities for expansion that extended beyond American borders. International distributors who had joined VitaLife Solutions for conventional business reasons found themselves operating sophisticated intelligence collection networks without realizing the true purpose of their activities. Health reports from customers in European and Asian markets provided early warning of biological threats that could affect American interests, while product distribution created channels for deploying countermeasures in regions where conventional diplomatic or military intervention wasn't possible. Dr. Rodriguez, monitoring the global network from her Miami station, watched real-time health data flow in from dozens of countries, creating a comprehensive picture of population health trends that no government surveillance system could match. The information revealed industrial accidents that weren't accidents, disease outbreaks that followed suspicious patterns, and environmental contamination that seemed designed to test population responses to novel biological agents. "We're not just responding to threats anymore," she reported to Margaret during their weekly coordination call. "We're predicting them. The customer health monitoring system is identifying biological weapons testing before the weapons are deployed operationally." This predictive capability represented a quantum leap in biological defense, allowing American intelligence agencies to develop countermeasures for weapons that were still in development, while providing evidence of treaty violations that could be used in diplomatic negotiations. The network had evolved from an innovative research program into a strategic intelligence asset that provided capabilities no traditional government operation could achieve. But success brought scrutiny that threatened the commercial cover that made the program possible. Regulatory agencies began investigating VitaLife Solutions' unusual effectiveness, seeking explanations for health improvements that exceeded what conventional supplements could provide. Pharmaceutical companies initiated industrial espionage operations designed to discover the manufacturing secrets behind products that outperformed their billion-dollar research programs. Margaret's response was characteristic in its elegance and audacity. Rather than attempting to hide the program's capabilities, she decided to showcase them through channels that would reinforce rather than threaten the commercial cover story. VitaLife Solutions would go public, transforming from a private MLM company into a publicly traded corporation that could fund expanded research through conventional investment markets. The initial public offering was structured to appear like a typical wellness industry success story, complete with testimonials from satisfied customers and financial projections based on growing demand for natural health solutions. Investment analysts who reviewed the company's prospects saw a well-managed business that had achieved remarkable customer loyalty and consistent growth in competitive markets. What they didn't see was that the IPO provided funding for research programs that exceeded the capabilities of most pharmaceutical companies, while creating legal and financial structures that could support global operations indefinitely. The commercial cover that had protected a single researcher's innovative approach to pharmaceutical development had evolved into a corporate framework that could sustain biological defense capabilities for generations. The stock offering was oversubscribed within hours, with institutional investors competing for shares in a company that represented the intersection of wellness trends, technological innovation, and entrepreneurial success. Margaret found herself featured on magazine covers as an example of American business ingenuity, celebrated for building a global health company from her Phoenix kitchen table, while maintaining the work-life balance that allowed her to support her family's activities. The irony wasn't lost on intelligence analysts who understood the true significance of her achievement. The suburban mother who had revolutionized pharmaceutical research through MLM marketing had become the CEO of a publicly traded corporation while maintaining operational security that protected classified programs worth billions of dollars. The wellness industry's most visible success story was simultaneously America's most secret biological defense asset. As Margaret stood on the New York Stock Exchange trading floor, watching VitaLife Solutions begin its first day as a public company, she carried the satisfaction of knowing that her unconventional approach to solving impossible problems had created capabilities that would protect millions of people from threats they would never know existed. The pink canvas bag that had seemed so out of place in NATO's crisis response had evolved into a global network that could detect and neutralize biological weapons faster than conventional intelligence agencies could even identify them. The future of pharmaceutical research would be written by entrepreneurs who understood that the most effective solutions often emerged from the intersection of commercial success and public service, protected by the assumption that serious national security work couldn't possibly be conducted by people selling vitamins at neighborhood coffee meetings. Up next, you've got two more standout stories right on your screen. If this one hit the mark, you won't want to pass these up. Just click and check them out.